Indonesia is stepping up healthcare spending as hospitals buckle under the pressure of the country's worst COVID-19 outbreak to date. Nearly $14 billion will be spent on coronavirus treatment and testing, as well as vaccines. At the same time, those with milder COVID-19 symptoms are being offered free telemedicine services. Another record has been set, with nearly 30,000 new infections in the last 24 hours.
A growing health crisis in Indonesia. Local newspapers like this have raised the alarm, warning of a paralyzed health system. The situation is particularly serious on the main Java island, where bed occupancy rates have exceeded 90%. Dozens of people died over the weekend at one hospital after oxygen supplies ran out. As hospitals struggle, Indonesia will provide free telemedicine services to coronavirus patients with mild symptoms. It's to reduce waiting times so that hospitals can be prioritized for severely ill patients. Others are helping out in their own way. This group of bikers volunteered to transport critically ill to the hospital, cutting through Jakarta's notoriously bad traffic.
Kalau dikawal dengan anak-anaknya ya kami merasa sangat senang sekali karena melerai kemacetan di daerah Kota Depok, karena daerah Kota Depok itu jalanan sangat padat merayap, terutama daerah Sawangan sampai ke Margonda. Itu sangat merayap sekali. Kalau tidak dilerai dengan anak-anaknya ya, wah kami tidak tahu deh apa yang terjadi.
The volunteers make as many as 20 round trips a day through the gridlock, all at their own expense.
Saiful Ismail joins us from Jakarta for more. Saiful, how serious is the oxygen shortage at this time?
It is serious, Steve. In Jakarta, we see long queues of people waiting to buy oxygen tubes. People are also refilling their oxygen tubes to treat family members who may be isolating themselves at home. Prices of oxygen tubes have also gone up. Hospitals now need to acquire more portable oxygen tubes to provide for patients housed in emergency tents. Now, the government has set up a special task force in the various districts and provinces to look into the shortage of oxygen in the country. It said the problem is with the distribution of oxygen supplies in the country. Now, Indonesia has the capacity to produce some 866,000 tons of oxygen per year. Normally, the industry allocates 25% to the production of medical oxygen. 75% is used for industries such as steel and nickel. Now, authorities have ordered the relevant industries to shift 100% of production to medical oxygen. Now, the industry ministry has said it will also consider importing oxygen tubes to meet the spike in demand from hospitals. Now, if I may just compare with a similar situation in India just a couple of months ago, India also faced a shortage of oxygen tubes with the surge in COVID-19 patients. The shortage was so acute that India had to rely on international help to get more oxygen tubes. Now, Indonesia was one of the countries which had sent oxygen tubes to India. Indonesia is facing a shortage of oxygen supply, but it has not come to a stage like what India had experienced. Hopefully, it won't come to that stage. Authorities have also urged people not to resort to panic buying and stockpile oxygen tubes. The country's second biggest Muslim organization, Muhammadiyah, has also issued a statement that it is not permissible in Islam to hoard oxygen tubes.
And Saiful, border controls are also being tightened to stem the spread.
That's right, Steve. Foreigners traveling into Indonesia starting 6 July are required to present a COVID-19 vaccine card showing they are fully vaccinated. However, vaccination certificate exemption is given to foreign diplomats and ministerial level officials. Foreigners are also required to show a negative COVID-19 test result. Indonesian citizens who enter Indonesia but do not have a vaccine card are required to present a negative COVID PCR test result. After being quarantined and are proven to be free from COVID-19, they will immediately get vaccinated. Now, this shows a shift in policy to use vaccination certificates as a new instrument for COVID-19 health protocols. Vaccination certificates are also required for long-haul travel on planes, trains, and buses within Java and Bali Island, which are currently under the emergency public activity restrictions until 20th July. Authorities are also increasing the quarantine period of travelers entering the country. Starting on Tuesday, foreigners and citizens entering Indonesia will need to go through 8 days of quarantine instead of 5 days previously. However, this quarantine period is still much lower than other countries which require a 14 days stay-home notice.
Okay, so Ismail in Jakarta, thank you for the update.